So the way Americans pay for healthcare is so weird, it's almost like mathematically stupid. Let's break down why. So part of being human, right, is that something horrible could happen to you at any moment. You're walking on the street, you're hit by a Land Rover, you get cancer from the power lines above your house, it's Daniel Mack surprises you at an intersection, you have a heart attack, whatever it is, okay? You have to go to the hospital, and you gotta get that problem fixed, and it can be extremely expensive to do so. More money than anyone could reasonably be expected to have. That means that each of us is incurring this enormous amount of risk, both medical and financial, just by walking around living. So how do we reduce that risk? Well, in a lot of countries, what they do is they pool everyone's money together via a system called taxes. And then when something bad happens to any particular person, that big pool pays for it. But because there are so many people in the pool, the cost to each individual is quite low and everyone is covered. In America, we do not do that. Instead, we have these smaller, private pools called insurance companies that you have to pay to get into. Now, there's two problems with this. One is, because the pool is so much smaller, they can't spread the risk around as far, which means they have to jack the prices up for everybody to compensate. That's why our healthcare costs so much more. So expensive that a lot of people can't afford to buy into it at all, leaving them completely uncovered and exposed to all that risk. But second, even if you're lucky enough to have coverage in this country, the fact that our system is run by for-profit businesses means that those companies are incentivized to try to avoid paying for your medical procedure, even if it's covered. And when that happens, you get stuck with the bill. So just to review, we pay more for worse coverage that covers less people. And the result of this is that in the US, we have skyrocketing rates of medical debt. Around 1 in 5 Americans has medical debt. In fact, a quarter of all of our credit card debt is actually medical debt. It's just people putting hospital bills on their Amex. 2/3 of all bankruptcies in this country are because of medical debt, something that's just impossible in other countries. So the way we pay for healthcare is hurting people's health and ruining their financial lives. It's very clear that we need a brand new system. We have to build it from the ground up. And that's taking a while. But as we continue that fight, there are still people that are working to solve the issue in other ways. On my podcast, Factually, I just interviewed a woman from an incredible organization called RIP Medical Debt. Check this out.
So you give us $100 and we get rid of $10,000 of medical debt. We have a 1 to 100 ratio of return on investment. The letters we receive back from people are like, the amount of mental anguish that they clearly are being relieved from is significant.
I mean, how cool is that? They use our donations to abolish other people's medical debt, freeing them from it forever. To learn more about them and to learn more about the case for single-payer healthcare, check out my podcast, Factually, available wherever you get your podcasts.